Welcome to the VitalScan training video. In the next few minutes, you'll learn how to operate a VitalScan system. The components of the system are as follows: ECG sensors for the chest, 3 pulse ox SpO2 finger and toe sensors, and blood pressure cuffs for the lower and upper ankle brachial index. In order to be able to perform a reliable VitalScan assessment, it is essential that you take the following patient preparations. It is required patients should not consume caffeine at least 2 hours before the assessment. Patients should not take any new medications or supplements unless directed by a healthcare provider. Patients with one or more of the following conditions should not be tested. Patients younger than 16 years old. Patients with pacemakers. Patients who are pregnant or suspect they might be pregnant. Patients suffering from heart arrhythmias. Heart arrhythmias could compromise the test. The test time is approximately 8 to 10 minutes. During the test, the patient has to be seated comfortably in a chair or to lie on their back, and to follow a number of simple instructions, while the VitalScan device records their blood flow and heart activity. Let's begin. First, you need to make sure that your VitalScan device is properly connected. Plug the USB cable into the laptop computer and into your VitalScan device. Check if the power cable is plugged into the back of your VitalScan device and is safely connected to the power outlet. Once you've checked all connections, turn on your PC laptop, open your VitalScan software, go to the Settings section and click on Check Device Connection in order to ensure the device is properly connected. When confirmed the USB connection is good, proceed with the plug in the sensors to the device box. The blood pressure cuffs as follows: the right arm cuff to be plugged in the NIBP1 socket, the right ankle cuff to be plugged in NIBP2, and the left ankle cuff to be plugged in NIBP3. Next, plug in the pulse ox sensors as follows: the left index finger sensor to be plugged in the PPG1 socket, the right toe sensor to be plugged in PPG2, and the left toe sensor to be plugged in PPG3. The ECG 3 lead cable should be plugged in the ECG socket. VitalScan is now ready to perform the test. From the software, select New Measurement and then select Autonomic Function Assessment. Keep all 4 stages selected: resting baseline, deep breathing, Valsalva, and standing or head up tilt. Select the sitting position if the patient is seated in a chair, or supine position if the patient is lying down. Press Continue. Select New or Existing Patient. Enter first and last name, date of birth, gender, weight, height of the patient. Enter also patient's medications and any known patient symptoms or previous diagnosis. Press OK. This leads you to the patient questionnaire. Guide the patient through the questions to get as many detailed answers as possible. This is very important and must be done correctly every time. Next stage is the pre-test screen, where you will be able to check the signal quality. On the lower right corner of the screen there is a diagram to guide you how to hook up the patient. When connecting the patient, start with the blood pressure cuffs. The function of every blood pressure cuff is determined by the socket it's plugged into. The device comes with 3 blood pressure cuff sizes. Choose the appropriate cuff size that fits the patient best. Usually, the green blood pressure cuff, medium size, is the most appropriate one for the ankles, and the orange blood pressure cuff, large size, is the most appropriate one for the patient's arm. All blood pressure cuffs should contact the skin directly. Roll up any long sleeves or pant legs if needed. Make sure the "This side to patient" label on the cuff is touching the skin. NIBP1 has to be put on the right arm. Make sure that the cuff is fit snugly around the arm and the arrow is lined up with the brachial artery. NIBP2 should be wrapped around the right ankle. And NIBP3 should be wrapped around the left ankle. Place the ankle cuffs about centimeter above the ankle bones. Once the blood pressure cuffs are fit snugly, proceed with placing the 3 pulse ox SpO2 sensors. Our VitalScan system has 3 PPG pulse ox SpO2 sensors, PPG1 to be placed on the left finger, PPG2 to be placed on the right toe, PPG3 to be placed on the left toe. Place pulse ox sensor 1 on patient's left index finger. Place pulse ox sensor 2 on patient's right foot second toe. If the patient's second toe is too big, you can use the third or even fourth toe instead. Place pulse ox sensor 3 on patient's left foot second toe. Make sure the toe fits the sensor properly. Next, you need to apply the ECG sensors. Ensure the ECG disposable electrodes are not dry or expired. Use one of those EEG disposable types. Apply the 3-lead ECG as follows. The lead is applied under the right clavicle. The black lead is applied under the left clavicle, and the yellow lead is below the last left rib. Check the signal quality to ensure if all sensors are good and are attached properly. Once the ECG signal is good, the 3 pulse ox signals have a good waveform, and a good heart rate appears at the bottom left corner of the screen. Now you can start the test. VitalScan is going to run through some breathing exercises after it takes an initial baseline reading. The device will provide instructions during every phase of the test. Make sure the patient is in a comfortable sitting or lying position, and the testing room is generally quiet before starting the test. Patient should not be distracted. Instruct the patient to avoid any movements and talking. Patient's movements can compromise the test. During the first phase of the test, the blood pressure cuffs will inflate, and the patient should remain seated while a baseline reading is taken. The patient will be asked to relax for 4 minutes, breathing normally, and avoiding any body movements. During the test, if the data quality is not good enough, the software will warn you to recheck the ECG sensor signal quality and to restart the test. Such a disruption may be caused also if the patient suffers from a heart arrhythmia. The second phase of the test is the deep breathing. During this phase, the patient should perform a breathing exercise for 1 minute. The patient should breathe in and breathe out deeply every 5 seconds. The next phase of the test is the Valsalva maneuver. During this phase, the patient is required to breathe in and hold for 14 seconds and then to exhale forcefully. The last phase of the test is the standing or passive head-up tilt. The patient should simply stand and relax in a standing position during the remaining time of the test. If you are using a tilt table, you will need to tilt the patient head up during that stage. Note that the blood pressure cuff will inflate to test the orthostasis. Once the test is completed successfully, you will be forwarded to the overview of the results page. At this point, you can disconnect the patient from the VitalScan device. The software results start with the overview page. Click on the Autonomic Function Test, which will take you to the general summary. The scales are displayed from red to green. Red is abnormal or most serious diagnostic. And green is healthy as you can possibly be. With light green is borderline. Yellow and orange can be concerning. However, if you end up referring out to a specialist,